Kaugnay ng pagdating ng mga bakuna na AstraZeneca sa bansa, makakapanayam po natin ang Ambassador ng United Kingdom to the Philippines na si Daniel Pruce. Good morning, Ambassador.
Good morning, magandang umaga. Thank you very much for the invitation to join you this morning.
Thank you so much and welcome to Unang Balita. It literally means first news in English.
Yes,
All right.
thank you.
First off, Ambassador, we understand that because the AstraZeneca shipment used a commercial flight, not all of the 525,600 doses were delivered and only 487,200 arrived. May we know, when are we expecting the rest of the doses to be shipped? And are we expecting more, Ambassador?
Thank you very much. And perhaps I should say, firstly, what a wonderful moment it was yesterday evening at Villamor Air Force Base when that first consignment arrived. So the first shipment of the AstraZeneca vaccine through the COVAX facility. As you know, His Excellency, the President, and many members of the government were there. It was an honor for me to be able to join them, and it really was a wonderful moment. As you say, there was a slightly smaller consignment than I think had at first been anticipated, but I think that's purely due to practical, logistical reasons and the amount that you can fit on an aircraft of the sort that arrived yesterday evening. Of course, within the COVAX facility, there will be further deliveries planned. I think up to around 4.5 to 5 million in total of the AstraZeneca vaccine, and other vaccines as well come through the COVAX facility too. And Medix, all of this is alongside the additional AstraZeneca shots, which will be coming to the Philippines through the agreements that the company have negotiated with the governments, the LGUs, and the private sector. So I think you'll see a steady stream of consignments arriving throughout the rest of the year. And in total, I think by the end of the year, we'll have something of the order of 22 to 23 million shots of the AstraZeneca vaccine in the Philippines, which I think is a fantastic achievement. And I pay tribute to everyone who's been involved in securing that.
Yes, because some of the local government units are already expecting. So are we expecting this to arrive anytime soon? Like, for example, in this month?
So I think the further consignments from the COVAX facility will be in the coming months. I mean, that's something which our colleagues in the World Health Organization here are working very hard on. And equally, those first consignments that will come through the separate tripartite agreements would also start flowing, I think, as we go through to the early summer and continue through the autumn. So I think there'll be a pretty steady stream.
Oh, that's good to know, Ambassador. Anyway, the rollout in Britain has been touted to be among the fastest in the world. What are the best practices that you can share with the Philippines? And how has the UK been supporting the Philippines in its COVID response in different areas, Ambassador?
So I think in the United Kingdom, we've benefited enormously from the expertise and capability in our National Health Service, which has been coordinating the vaccine program in the United Kingdom. As you will know, the very first vaccine that was administered in the UK in early December in Coventry was in fact administered by a Filipino nurse, matron May Parsons. And that was the first vaccine to be given to anyone, anywhere in the world, outside of a clinical trial. And the NHS, benefiting from over 30,000 Filipino healthcare workers, has continued to coordinate our rollout. And I think the key points that I'd reflect on are firstly using many channels to administer the vaccinations. So hospitals, doctors' surgeries, we've used pharmacies, we've used large-scale vaccination facilities, sports grounds, for example. I think the other issue as well, which has been really important, is communicating to people the importance of being vaccinated and addressing some of the misleading information that sometimes circulates around vaccines and trying to overcome any hesitations that people may have.
Exactly, Ambassador. I understand that Britain's Vaccine Advice Committee has advised that vaccinations be done by age rather than by occupation. Can you elaborate on your prioritization? And do you think this is also advisable here in our country?
So I think in common with the Philippines and other governments, we've approached our vaccination program on a priority basis. So in our initial wave, where we've now vaccinated over 20 million people, we've looked at frontline workers, including those in the health sector. We've looked at the oldest members of our community. We started with the eldest and sort of working our way down the age ranges. And also looking at people who are clinically vulnerable, who have vulnerable conditions as well. And my understanding is that the Philippines are following a similar model here. And we've worked very closely. I mean, in recent weeks, we've had a number of very active and well-attended roundtable discussions with our friends and partners here in the Philippines, sharing the experience of the UK's vaccine rollout. We've reached well over 2,000 people here in the Philippines who will be directly involved in vaccine deployments throughout the country.
All right, we are curious, Ambassador, what is the Britain doing to curb the spread of the more infectious UK and South African variants?
So I think in common with many other countries, we continue to encourage all of our citizens to follow those basic healthcare protections, so wearing masks, keeping your hands clean, maintaining social distance. In addition, we have a number of lockdown restrictions. We are in the midst of the lockdown at the moment. We have restricted international travel as well. But we have also set out, and the Prime Minister did so just recently, what we hope will be a gradual pathway in the months ahead to ease those restrictions as our vaccine program rolls out. And we're already seeing that the vaccination levels appear to be reducing the levels of cases and hospitalizations in the UK.
All right, Ambassador, the European Union is planning to extend its export authorization scheme. We understand that Britain is no longer part of the EU, but I hope you don't mind me asking if you agree with such move, Ambassador.
Well, as you say, we are no longer members of the European Union.
Yes.
But I think my more general observation would be, the importance of the really strong international effort that we've seen to share and collaborate and to ensure equitable access to vaccines globally. The vaccine consignment that arrived last night was under the COVAX facility. This is a facility that the United Kingdom strongly supports. We're amongst the biggest donors to that facility. We've contributed £548 million. And I think it's absolutely critical that we continue with this approach based around ensuring equitable access globally to safe and effective vaccines that have been developed transparently. As people say, and it's absolutely right, none of us are safe until all of us are safe. So ensuring that widespread equitable access is absolutely key.
So this is an assurance, Ambassador, that this will in no way affect the supplies that will be coming here in the Philippines.
Well, I think what I can say is, as far as the efforts of the British government are concerned, our commitment to doing all we can to ensure equitable access remains rock solid. As I said yesterday, my personal commitment to the work that we're doing in the Philippines remains absolutely firm, and we will be with you as we all go through this and hopefully see some light at the end of the tunnel.
Thank you so much. Maraming salamat po, British Ambassador Daniel Pruce. Stay safe, and we hope to see you soon.
Maraming salamat. Thank you very much indeed.